Today we discuss about annual visits to the doctor. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. So health checkup. It depends upon the age. So if your age is greater than 50 years, at least you should require once a year. And if your age is less than 50 years, at least once every 3 years. And if patient has a chronic illness, example diabetes or blood pressure, such patients may require more frequent visits. There are various problems which are related to annual visits. Sometimes the insurance, many times transport, not possible to go to the hospital due to ill health or non-availability of transport. Financial issues are also there, such as the doctor and oblique hospital charges, costs for the investigations and medications. There are various reasons for medical checkup. If you are sick, if you have symptoms of any disease, you have chronic or ongoing conditions such as diabetes or blood pressure or thyroid, if you have any side effects of a new medicine, if you're managing smoking, obesity or other lifestyle factors, pregnancy, if you are going for a family planning, STD prevention and healthy lifestyle, for other reasons that are based on your individual needs. Self-preparation. Prepare your own medical history. Carry your old medical records. It's much more convenient if you prepare your own medical history and carry your own medical records. Make a list of all changes in your medication surgery since your last visit. Make a list of all new symptoms since your last visit to the doctor. And remember to communicate well with the doctor. It should not happen that after meeting the doctor you say that, oh, I forgot to mention this point. And list any queries you would like to ask the doctor. What to expect? There is no routine protocol. Each doctor varies. And doctor will ask you your current health issues. He may ask more details about your current health issues and past history, which you may not have mentioned. He may provide guidance for your health issues and risk factors. So, in the history he'll ask about the current health issues. He'll ask you about addiction, smoking and alcohol intake. He may ask you about exercise. He may ask you about sexual health, diet, vaccination history, personal and family history. So these are very things which he asks on the history, and these are usually provided by the patient themselves. And it's much better if you can have a record. I've already made a video on how to write your own medical history. He'll examine you. He'll see the heart rate and pulse. He'll see the blood pressure. He'll see the respiratory rate. He'll check the temperature. Examination as deemed necessary. It may vary from patient to patient. Physical examination. When you enter the cabin, he'll check you for walking and talking. He's watching you constantly, and he may check for your mental alertness also. Systemic examination. He'll look at the heart for the beats and abnormal sounds. He'll look at the lungs for abnormal or decreased breaths. He may examine the head, neck, ears, nose, sinuses, eyes, lymph nodes in the neck, thyroid and neck blood vessels. Abdomen, he'll feel for the liver and spleen. He may hear for the intestinal movements. He may examine for abdominal pain and the presence or absence of abdominal fluid. Systemic examination. He'll do a neurological examination to see your mental state, nerves, strength of muscles and balance. He may examine your skin for problems of skin. Limbs, he'll examine for blood supply, movements, weakness and joint issues. In the male examination, it may examine the testis, hernia, penis and prostate, especially in the elderly. Female examination consists of breast examination and pelvic examination. Investigations. He may ask for basic tests such as complete blood count, liver function test, kidney function test, blood sugar, fasting and postprandial, lipid profile, urine routine and microscopy, X-ray, chest, ECG. Mammogram and pap smear are recommended only for women. Other tests such as thyroid test, vitamin D3, vitamin B12, ultrasonography are required and there may be some other tests which are required as per the individual needs. Prevention. So if you want to avoid this sort of disease, do lifestyle modification, exercise around 30 minutes per day, have a plant-based diet and avoid smoking. I've put a separate video on lifestyle modification, especially for the patients who are diabetic and hypertensive. When you go to the doctor, you may have to visit various doctors. Primary doctor, eye specialist, dentist, gynecologist, skin specialist, and other doctors as per your individual requirement. Advantages. May help to detect life-threatening diseases earlier. Early detection means early appropriate treatment. Prevention and delay of complications. Ensures discipline of compliance to medication. So if a patient is not taking medications regularly, doctor may tell him that he should take medicines regularly. Monitoring of the existing conditions and regular follow-ups may restrict admissions. Thank you for watching the video. Please do not forget to like the video. Please feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.